Hello future dentists, welcome back to Exam Keeper Dentistry. Today we are going to study an important functional orthodontic appliance, that is a Bionator. Have you ever wondered why is Bionator called a modified activator? What makes it less bulky, and why do examiner love asking its indication and components? So don't worry, by the end of this video you will understand definition, types, component, diagram explanation, indication and important Viva question. So keep your notebook ready because this topic is very important for the BDS exams and the Viva. Okay. So what is Bionator? So let's understand with the basic definition. So Bionator is a functional orthodontic appliance which is developed as a modification of the conventional activator. Okay, so the main difference is it is a less bulky and it is more elastic and comfortable for the patient. So patient can wear it more easily compared to the traditional activator. So here the exam point is Bionator is a less bulky and more elastic modification of the activator. Now the types of the Bionator. So now let's discuss the type. There are the three types of Bionator. So first one is standard appliance, which is mainly used for class 2nd division 1 malocclusal. Second one is class 3rd appliance, which is used for the class 3rd cases. Third one is open bite appliance, which is used in patient having the open bite. So easy trick to remember is SCO, that is S for the standard, C for the class 3rd and O for the open bite. Can you tell me which type is used in open bite cases? Yes, that is a open bite appliance. So now let's study the standard appliance in detail because this is the most commonly asked in the exam. So standard appliance, so it is used for the treatment of the class 2nd div 1 and class 2nd malocclusal, which is having the narrow dental arch. It consists of the relatively slender acrylic body which is fitting to the lingual aspect of the mandibular arch. So you see, this is the lingual aspect. This is the acrylic body which is fitting to the lingual aspect of the mandibular arch and the part of the maxillary arch. And this one is the part of the maxillary arch. The acrylic extend up to the distal of the first permanent molar. The maxillary plate, this is a maxillary plate which is covered only the molar and the premolar with the anterior region remaining the uncovered. Okay. Now here the acrylic extend 2 mm below the gingival margin. Come the most important exam question, that is a wire component. So the two main wire components are palatal arch and the vestibular arch. So the palatal arch is made up of 1.2 mm diameter wire. It emerges opposite the middle of the first premolar. So you see they here first it is a first premolar. Then follow the contour of the palate, forming the curve that reaches the distal surface of the permanent molar. Then it is follow the contour. It is reaching the first permanent molar. So this is the first permanent molar. It is reaching the first permanent molar. The palatal arch is kept 1 mm away from the mucosa. Okay. So here the path of the wire is, it is just the opposite of the first premolar. Follow the contour, then it is reaches the distal to the first permanent molar. Then it follow a curve. Then reaches to the distal surface of the first permanent molar. Okay. So here the vestibular arch, it is made up of 0.9 mm stainless steel wire. It emerges from the acrylic below the contact point between the upper canines and the premolar. So you see this is the upper canine and this is a premolar. So here it is emerged like this. Now it rises vertically and bend at right angle to go distally along the midline of the upper premolar canals. So now it goes vertically, it bend at right angles, then go vertically. Now mesial to the molar. So suppose now you see this is a molar. So mesial to the molar, a rounded band is made. So this is a rounded band is made so that the wire runs at the level of the lower papilla up to the mandibular canine. So here you see this is a mandibular canine, up to the mandibular canine it runs, where it band to reach the upper canine. Now this is also band, then it reaches the upper canine. The vestibular wire is kept away from the surface of the incisors by the thickness of the sheet of the paper. Okay. So this is very important because it avoids unnecessary pressure on the incisor. Okay. So this is a vestibular arch wire. Now the indication of the Bionator. So now let's understand the discussed indication. So first one is Bionator is indicated in class 2nd div 1 malocclusal, which is having the following features. Like first, that is a well-aligned dental arches. That is all. Now the next one is retrognatic or the retrograde mandible. This is a retrograde mandible. Third one is that is not very severe in skeletal discrepancy. Then it is used in mild skeletal discrepancy. Fourth one is when there is labral tipping of the upper incisor. Now the second indication in class 2nd malocclusal, that is where the reverse Bionator can be used. Third one is in open wide, that is using the open Bionator can be used. So here the important exam point is Bionator works best in growing patient. Okay. So before the ending, let's revise quickly. So one line revision is Bionator, it is a modified Bionator, less bulky and more elastic. 3 types of Bionator, that is a standard, class 3rd and open wide. Palatal arch, which is 1.2 mm wire. Vestibular arch, which is 0.9 mm wire. And acrylic extend 2 mm below the gingival margin, and it is mainly used in class 2nd div 1. So student, this was a complete easy explanation of Bionator appliance. If this video helped you understand the topic easily, then like the video, share with your BDS friend and subscribe to Exam Keeper Dentistry. See you in the next lecture.